Welcome back. Aaron Rand with you. Natasha's off this week. She'll be back next Monday. Is that correct? Monday, yes. I knew that. Look, I came across this headline and I thought, wait a sec, we need to talk about this. It reads as follows. For decades, doctors have been telling their patients that high levels of HDL, so that is what's known as the good cholesterol, could protect them from heart disease. But now a new study suggests that having a lot of that so-called good cholesterol does not necessarily mean you lower your risk of heart attacks. So what are you supposed to do? I mean, it's okay to have the bad cholesterol again? Chris Labos, Dr. Chris Labos is a cardiologist. He's got a degree in epidemiology as well, and you can hear him Sunday mornings here at 8:10 on CJAD on Weekends with Ken. So Dr. Labos, let's talk about this from, it's nice to not talk about COVID for a change, but this seems to me, unless I'm reading this wrong, a pretty big change in what we've been told up until now with respect to cholesterol, is it?
Yes, it is. Now, it's interesting because I always love when I see sort of medical headlines saying doctors have been saying this for decades and this is a sudden change. In fact, the HDL hypothesis, this idea that HDL, the good cholesterol, is protective, has actually been losing steam for about the past 10, maybe even 15 years. And really what happened was if you go back to 2015 or so, so a few years back, the various pharmaceutical companies tried to create medications that would boost good cholesterol, that would boost the HDL. And a lot of those studies failed. The medications were unsuccessful, and some of them had actually surprisingly negative side effects. In a lot of these studies, there were actually more strokes and more deaths in the people who got the study drugs. So really, for the past few years, there's been a growing recognition that trying to increase HDL is actually not a useful medical strategy. And more research has been showing that the thing that really causes heart disease is the bad cholesterol, the LDL, and that the lower you can get the bad cholesterol, the better off you're going to be. And the number that you get on your blood test, the number for HDL, the good cholesterol, is really not that useful. And a lot of us more and more have really just ignored it because there's nothing much that you can do about it. And it's not really a useful thing to be focusing on in terms of treating the patient that's sitting in front of you.
So you've said two things in there that are interesting. So that medication that they thought or hoped would boost your HDL, your good cholesterol, is basically unnecessary and actually maybe even a bad idea. But with the idea of your bad cholesterol, so you're still supposed to limit that, though. That doesn't change.
No, and what you've seen with the guidelines is they've become more and more aggressive with each iteration, and so we target lower and lower cholesterol levels. And the reality is that we go lower now than we've ever gone before, to the point where there are still a lot of people out there saying, it's dangerous to lower your cholesterol too much. I think now when you look at the scientific evidence, it's very clear that that's not true, because we take people who have heart attacks and strokes, we take their cholesterol down to exceptionally low levels with a lot of the newer medications that have come out. And in fact, we haven't seen any adverse events. We haven't seen any medical complications. People will say things like, if your cholesterol is too low, that's going to affect brain function because your brain needs cholesterol. Well, that has proven to be not true. There's a whole lot of claims that have persisted from studies done from the 1970s, 1980s, even the early 90s, and you see people still recycling a lot of these old commentaries, even though, in fact, now we can see that lowering your bad cholesterol with different types of medications, so not just statins, which have become a lightning rod for people claiming all sorts of things on the internet, but no matter what type of medication you use, the lower you get your LDL, the greater your cardiovascular benefit, and that is true regardless of the mechanism by which you achieve that cholesterol reduction.
So can you, just for kind of to give people an idea, when we talk cholesterol, it's a general idea of cholesterol. What are we talking about? What foods are we talking about here with respect to the bad cholesterol?
So interestingly enough, most people who have high cholesterol, it's usually genetic. So everyone asks me, can I try diet and exercise? Is that going to make a difference? And it's yes, it'll make a bit of a difference in some people, but most people who have high cholesterol, a lot of it is genetically mediated. And in fact, to get people down to sort of target levels, to get them down to the very low levels where we're seeing the significant cardiovascular benefit, it's almost impossible to do that without medications, because the medications are actually inhibiting the enzymes that regulate cholesterol manufacturing in your body, because a lot of the cholesterol is manufactured in your liver. It's a little bit more complex than that, but I'm simplifying here. So a lot of the cholesterol is made inside of you, and so you have to block that process, and that's really only achievable by medications. But I mean, diet has a bit of an effect, and that's why you want to avoid excessively fatty food. And there are sort of extreme cases of people who have bought into these fad diets, who eat, 4 egg omelets every morning and all that, and they can have very, very high cholesterol levels. But unless you've really deviated from anything resembling normal human behavior, your diet doesn't have that much of an impact. Although, again, of course, you should try to avoid fatty food, especially fried food and stuff like that. But a normal diet is usually okay for most people.
So just to repeat, what you're basically saying is, and that's kind of a surprise to me, I had no idea. You're saying diet, yes, it may have some significance, but perhaps not as much as we've attached to it in the past. So if you want to eat steak a couple of times a week, as long as you're not eating it every single day of the week, you're probably okay. You can still continue to eat red meat and not have to worry about heightened cholesterol levels?
Yeah, and here's the thing. I mean, now, the issue of red meat is a whole interesting one, because then you get also into the colon cancer risk of, red meat and all that. But yeah, so here's the thing. You can eat the food that you enjoy, but you shouldn't eat a lot of it. And the more that we can switch towards more, fruits and vegetables and less red meat, the better off we're going to be, not just in terms of cholesterol, but also cancer risk. So it's again about eating healthier, not necessarily providing prohibitions against specific foodstuffs, because that's hard for people to stick with.
What do you say then when you have someone who will say to you, okay, I don't believe, now even though you just said these medications that we have now beyond just statins actually work, they do what they're supposed to do to lower cholesterol levels, but there are people who just don't want to take medications. What do they do?
Well, I think, listen, you have to explain to people, and a lot of times people say, I want to try diet and exercise. I'm like, okay, go ahead, but let's make a contract. When you come back in 6 months and your cholesterol hasn't changed, we have to start the therapy. And I think that's the problem a lot of people have. They keep postponing starting medication, thinking that their lifestyle modifications are going to have an effect. And look, it's perfectly reasonable to try. And in fact, the guidelines do say start with lifestyle modifications for people who aren't at exceptionally high risk. So it's like, okay, you want to do that? That's fine. Let's do it. Here's the blood test requisition. Come back in 6 months or 4 months or 9 months or what have you. But set a date, come back, and if it hasn't decreased to what you need it to be, that's when you have to start the medication. And of course, nothing prevents you from doing both of those things simultaneously.
Right.
You can adopt a healthier lifestyle and start medical therapy, especially if you're moderate to high risk for cardiovascular.
Am I to assume then, as you describe this, let's say you do all the other things like the diet, like the exercise, et cetera, and you're on the medication, does that mean once you start the medication, you're on this for life? Can you get on and get off, or does that not work?
Well, there are certain people who have stopped them because they really drastically changed their lifestyle. And again, they were people who had done, they were eating very, very bizarre fad diets, right? So for the small subset of the population for whom it is diet-mediated, then yes, you can potentially get off some of these medications if you change your lifestyle. We tend to see it more for blood pressure and diabetes, less so for cholesterol, because again, it is very genetically mediated in a lot of people, especially here in Quebec, actually, where there's a very high percentage of people who have a genetic condition called familial hypercholesterolemia. A lot of people have the genetic mutation that increases their cholesterol level. So for those people, it's very hard to come off of that because your genetics haven't changed. But for the small subset of the population where it's diet-mediated, then yes, you can see benefits there. Is
there such a thing as a healthy, I mean, I realize there are levels, but I mean, a healthy cholesterol level, you just described it, if it's not about diet and you just eat like normally, like anybody else would without going overboard on anything, does that necessarily, if it's not genetically affected, give you a healthy cholesterol level?
So here's the thing. I mean, more and more we sort of joke to ourselves that LDL, bad cholesterol, is basically a garbage molecule. People have said that sort of thing, meaning that you don't need it. It doesn't serve a useful function in your body. It's there as a consequence of our lifestyles. And so if you could remove it completely, you would be at the lowest possible risk. And there are people who have the converse of those genetic mutations who have genetically very, very low cholesterol levels. And they've essentially won the genetic lottery because they're probably never going to have a heart attack or a stroke because because their cholesterol levels are so low. So you can, the lower we could get cholesterol down, the better off everybody would be. It becomes a question of cost effectiveness because some of the newer medications are quite expensive, and so we have to get the costs down on those. And that's a whole other discussion about how we regulate drug pricing. And then, of course, there's cost to society, there's cost to doing all the blood tests, there's cost to, regular follow-up. So we always have to weigh the risks and the benefits. For a low-risk population, lowering your cholesterol probably doesn't get you much bang for your buck, whereas for a high-risk population and people who have had heart disease and stroke, then there's clearly a benefit to be drawn there. So you always have to look at where you lie on that sliding scale of risk and how much benefit you draw from the treatment regimen that you have in front of you.
So I was just going to ask as a last question here. So you find yourself in a situation where maybe people are discovering this based on what you just said, Dr. Labos, that you didn't win the genetic lottery because you're predisposed to high cholesterol given your genes. But if that's not the case, are you seeing more high cholesterol now than you were, say, 5 or 10 years ago, or not?
I don't think that the cholesterol levels have really changed, but our appreciation for it has certainly changed. We were a lot more permissive, let's say 5, 10, 15 years ago. Like we would see people with like moderately high cholesterol levels and we would say, it's not that bad. Whereas now we're saying, no, we should probably treat that. Like there's no reason to leave somebody with high cholesterol in the same way there's no reason to leave somebody with high blood pressure or high blood sugar. You're just doing them harm over the long term by not treating their risk factors.
Okay. Informative as always. I thank you so much. Appreciate it, Dr. Labos. Thanks.
My pleasure.
There you go. Dr. Chris Labos, by the way, he can be heard, I think I mentioned this off the top, weekday mornings, 8:10, on Weekends with Ken, and that's every Sunday morning here on CJAD 800.